welcome to this month's Wild World of Wounds. This month, indications for hyperbaric oxygen therapy. What are the approved indications anyway? It's not television, it's hyperbaric oxygen therapy. Alright, HBO, let's go through it. Here we go. Well, what are the mechanisms? If you think about the mechanisms, you can kind of understand why the indications we have are the indications that are approved. So one mechanism is it compresses bubbles. We know from Boyle's law that gas volume decreases in proportion to increasing pressure. So if we can increase that pressure, we can make those bubbles shrink, go back into solution, and that's a good thing if you have if you have decompression sickness, for example. Excess nitrogen bubbles floating around that shouldn't be there. It can also displace toxins like carbon monoxide, for example. It can enhance the immune response. Now that can work a couple of ways. One is that it is synergistic with certain antibiotics because certain antibiotics have an oxygen-dependent requirement for them to function properly. And in addition, white blood cells can't function properly below a certain oxygen tension. They cannot phagocytize and kill bacteria or invading organisms as they should below a certain PO2. So hyperbaric oxygen can enhance the inherent immune response and white blood cell function. Obviously reverse hypoxia, and then there's wound tissue growth and increased vascularization with angiogenesis and reversal of fibrosis. And they think it's that gradient between higher oxygen and lower oxygen tissues that enhances the stimulus for angiogenesis, for new blood vessel growth, which of course is what's needed for granulation tissue formation and eventual healing. So who are the UHMS? They're the Undersea Hyperbaric Medical Society. And they make recommendations on approved indications for HBO based on the literature. They publish the Oxygen Therapy Committee report of approved indications, and their approved indications are, it's important to know, are not synonymous with the CMS approved indications that we're going to review today. Indications and CMS approval change constantly, so you do need to review this very frequently. Obviously, before you start treatment with a patient, make sure it is an approved indication. But what often happens is if the UHMS approves something, that puts pressure towards getting it approved by CMS. So let's go through these indications. Thinking about those mechanisms, we talked about toxin displacement. Obviously, carbon monoxide is one indication for HBO. And then cyanide poisoning as well. Of course, cyanide and carbon monoxide often will go together when you have burning of plastic and at the same time carbon monoxide inhalation. So these two indications can often go together. Decompression sickness. So you have excess nitrogen that is dissolved into the tissues. It is off-gassing because you're decompressing too quickly. Bubbles form, and those can cause all different types of symptoms. It could be decompression syndrome 1, where it's really just musculoskeletal, more minor symptoms, or decompression sickness 2, where it becomes CNS, or can cause cardiovascular collapse, the chokes, difficulty breathing. This is another approved indication for hyperbaric oxygen decompression sickness. And then gas embolism. We have a tear causing a pneumothorax. We get an embolism of air that can go to your brain, cause stroke-like symptoms. These are the patients that collapse very quickly upon surfacing. And again, both for gas embolism and decompression sickness, shrinking those bubbles by Boyle's law makes a lot of sense. Gas gangrene and progressive necrotizing infections are another CMS indication. Besides the white blood cell function enhancement and the synergistic effect with certain antibiotics, obviously for an anaerobic infection, hyperbaric oxygen can directly attack those anaerobic bacteria by raising that oxygen tension. But that's not, again, the only mechanism by which HBO enhances immune function. Acute traumatic peripheral ischemias, so an acute peripheral ischemia, as well as crush injuries and suturing of severed limbs. Never a happy day when you have to deal with that. Acute peripheral arterial insufficiency. Again, all these last few are obviously the main mechanism we're looking at is just enhancing oxygenation to those damaged tissues while your body's trying to repair, either on its own or after a surgical procedure. Preservation of compromised skin grafts. So it's not approved as an indication for preparation of a first skin graft. But it is approved if you have a skin graft or flap that appears to be compromised. As long as you have some of that graft that is still salvageable, this is a CMS indication. Chronic refractory osteomyelitis, unresponsive to standard medical and surgical treatment. This is another indication. And again, this goes to the enhanced immune response, bacterial killing, white blood cell augmentation, antibiotic synergy associated with hyperbaric oxygen. And then osteoradionecrosis for treatment, again, not prevention, is approved. And soft tissue radionecrosis. Now this goes to the anti-fibrotic effects of HBO. Often the irradiated tissue becomes very fibrotic, and there's some controversy exactly as to the mechanism of how this occurs, but it appears that hyperbaric oxygen has a role in increasing angiogenesis, increasing oxygenation to these tissues so that they can heal. And then something we don't see very often, actinomycosis infections. Actinomycosis, bacterial infections that commonly affect the face and neck. Not the most common infection, but hyperbaric oxygen is indicated for this as well. And finally, a diabetic foot ulcer that is a Wagner grade 3 or higher. That's a deep ulcer. Wagner 3, a deep ulcer that includes a deep space infection, abscess, osteomyelitis, for example. That would be a Wagner 3, and they would qualify as a CMS indication as long as they have failed 30 days of standard of care therapy. Standard of care therapy, you've done all the things you're supposed to do. You've offloaded the patient, you've made sure they have a good arterial supply, you've removed the dead or necrotic tissue, you've controlled infection, you've got their diabetes optimized, but you are not healing this wound. You've done everything you're supposed to do, all standard of care treatments, and you're still not getting where you need to go and this wound is not healing. They would also be an accepted CMS indication for hyperbaric oxygen therapy. All right, well, in the coming months, we'll go through some of these indications in much greater detail. But this month, we've gone through this as a general overview of the CMS indications for hyperbaric oxygen therapy. I hope you enjoyed this wild world of wounds. We'll see you next month. Bye for now.